I'm Dr. Beatrice Terry, board certified periodontist, and I practice in Miami, Florida. My practice is called Miami Implant Perio. Today I will be sharing with you a procedure to grow bone in areas that are deficient or atrophic maxillas. This is utilizing a customized bone block by the company Zimmer or ZimV now, and it's using CBCT scanning and intraoral scanning to replicate the defect that exists and create a customized bone block that will be placed in position so that future implants can be put in the area. The case I will be treating today is a young lady who sustained a boating accident and lost tooth number 9. She was already congenitally missing tooth number 7 and 10, and 7 has been replaced with an implant and crown. 10 also has an implant in place, and we're hoping to augment the ridge in the area of number 9 so that we can get implants in the space of 9 and 10. So historically, bone blocks or J blocks have not been very successful in ridge augmentation. They were prematurely exposed and were infected and had to be removed, and or size-wise, maybe they weren't ideal because they weren't made for the patient. Number one, the process of the way the bone is made is different and allows for more regeneration. And number two, it's customizable. So it's made to fit the ideal structure that we're trying to recreate versus getting a piece of bone and trying to fit it or retrofit it into the space. After achieving optimal anesthesia, I went ahead and flapped the tissue, accessed the bony defect, prepared the bone, and placed the custom bone block. My assistant is helping me here keep it stable and therefore allows me to fixate it with the screws. After the fixation, then I am placing some particulate bone around the edges of the bone block so that I can get a smooth transition from the bone block to the underlying bone. Then I'm placing a pericardium type membrane over the site, releasing the tension of the flap and achieving primary closure via sutures. Finally, inserting a provisional type of retainer for her to wear for comfort and for aesthetics. Patient will wear this for 24 hours, and then I will have her remove it as much as possible so that there is no pressure on the underlying tissue while healing is occurring. And once follow-up is complete and sutures are gone, we'll probably wait about 6 months to then go take a radiograph and see what kind of regeneration we've achieved, how mature that tissue is, and then I plan to place implants in this area. This is something to look forward to, and I think that the future is right for this type of technology. Thank you for watching. I hope you learned something. If you are a clinician and you have any questions, feel free to reach out to me. If you are a patient that needs something similar to this, feel free to share this with your surgeons. Thanks again.